Hi, everyone. Welcome to week 4 of Public Health 645, investigating the opioid overdose epidemic and some of the strategies, evidence-based strategies and impacts in our communities. I wanted to record another video for this week, mainly to cover what we've gotten to up to this point. I'd like to review how the class did on test 1 and prepare you for test 2 a bit, which will be posted this Friday and due by Sunday night. So test 1, as you know, covered modules in week 1 and week 2 of the course. Uh, all of the required readings and videos. Our next test will cover modules 3 and 4. Weeks 3 and 4 include by far the heaviest reading and content load for the course. So there's been a lot there. And in the past 2 weeks, you were assigned a total of 18 new readings and videos. If we're looking at both of the module 1 and module 2 content, or I'm sorry, the module 3 and module 4 content. So we'll look through these piece by piece and talk about some of the key facts that you may need to pull out of these videos and articles for the next test. But what I wanted to do first was take a peek at test 1 results. And by now, really, you should understand the design, the basic design of the Healing Community Study as it was a multi-site parallel group cluster randomized waitlist controlled trial involving 67 communities, 34 in the intervention arm and 33 in the waitlist control arm. Obviously, Kentucky, Massachusetts, New York, and Ohio were included in this study. And reading through this article and watching some of the videos, you should have gotten a real good handle on some of the different rates that are reported or aim to be affected in this study, and gotten a sense of what the primary finding of this study was when these results were published last year. So looking at test 1, I still need to go through and grade these one by one because there's a couple items that I need to check and grade individually. But you can see that overall the high score was 89% at this point. I may be adding some points to some students' tests. And when we get to the first question, it was responded to accurately by 56% of the students. I'm going to look at what are some of the other responses that some of you provided on this question, which was really intended for you to just simply pull out a number from the overdose reports that were required reading from Kentucky and Ohio. Some of the other questions in this test came from the Healing Communities articles that you were assigned, but a fair number of these questions basically forced you to open up the overdose fatality reports from Kentucky and Ohio that were posted, or in some cases, you could probably just ask ChatGPT the answers or another AI the answers, and they may come up with them. But I think looking through the reports is a really important way to understand how the states report out to the public what their statistics and trends are looking like. So let's just hop to the ODH report that was part of the required reading, and we'll just settle down on this chart here. as a review, you can see here that line graphs go back to 2014. However, the CDC really officially declared the prescription opioid crisis and the opioid epidemic as far back as 2011, right? So when US age-adjusted overdose death rates were 13.2 per 100,000 at the beginning of the epidemic, you can see that very quickly rose up in the state of Ohio. Um, they were already well above that in 2011, and they continued to rise every year until there was a marginal decline 27, 2018, and then they sort of hop back up again going into COVID. On this graph, you can see it, Ohio's crude rate um, on this axis over here between 20 and 25 back in 2014. Actually, the specific rates were 24.6 for Ohio, and in Kentucky, the rates at this point in time, 2014, were slightly higher, 24.7. And if you looked at both of these reports, this one from Ohio and the other one from Kentucky, you'll notice Kentucky didn't have this trend line reported in there. And there's other ways you can pull statistics on the states, and I'll show you that leading up to the assignments you'll have for your final paper. But at this point in time, just for test review purposes, you could find all the facts within this document or the Kentucky overdose report, which I'm not going to share. Another just interesting aspect of the differences in states and a feature that's important when people are talking about today, that's successes, I guess, that we're having with reductions in overdose death rates in Hamilton County in Ohio and some other high impact counties. We would still need to reduce rates quite a bit, 300 to 400% to get back down to the time when this wasn't considered a crisis or an overdose epidemic at the national level. And when you're working within your own states, if you're outside of Kentucky and Ohio, I would encourage you to look for these kinds of reports. And in addition to that, reports from your own state, if they publish reports like these. And if they don't, you can ask an AI, ChatGPT, for these kinds of estimates. And I was playing with that a little bit, and it'll pull down the data from different sites. So for Kentucky, for example, if you ask for a line graph, it doesn't give you one, or at least didn't give me one, but you can pull down rates that appear to be consistent with what's in the state and national statistics. But again, more about that as we're leading into the final. For test review, I think it's important to know that you need to be able to find these sort of county level and state level estimates from primary documents like these. And when we got back into the test questions, you were asked to identify particular counties with the highest rates, right? So here in this report, Scioto County in Ohio had over 130 deaths per 100,000 reported in this report. In Kentucky, in their document, Estill County was the highest, and it had in excess of 180 deaths per 100,000 in that county. So just way off the charts in terms of this axis, just giving you a sense of the kind of drastic variation in overdose death rates across the United States and within the states across counties. Here represented in lighter or darker colors according to their um, relatively extreme death rates per 100,000 population. So again, this is just a review of where you were able to find information when you're asked for it in test one, either by reading through the article or finding this data on the internet using other ways to pull health statistics. Again, it is important, I think, a lesson to understand that the peak that you see here in Ohio in 2021 is basically the highest drug overdose death number of deaths and the highest death rate reported in history. So in that 12 months ending in January 2021, the U.S. reported over 94,000 drug overdose deaths in preliminary analyses. And Hamilton County is getting attention related to this decline more recently. But you did read in the Healing Communities study that their initial analysis did not find the impacts to be statistically significant against the target in the target counties versus the control counties. So there's more to come about that later on in the course, but I did want to spend some time looking at this particular graph and talking about this peak and this decline as it maps onto the national statistics, but it also represents our state of Kentucky and Ohio that are well disproportionately affected. So many other test one questions were simple facts from the assigned articles, such as the primary conclusions of the Healing Communities study and the units of analysis there, the sort of evidence-based practices that were reported in the Healing Communities study. Most of you, well, all of you that responded to this got this question correct. Simple fact about which states were included. And most of you understood that the unit analysis was counties and municipalities, meaning that the targeted effect was at the quote unquote county or city or municipal level. Test two will be a bit longer than test one. Again, we've covered a lot more in week 3 and ongoing in week 4. So there will be a larger number of questions. In this test, test 1, the answers we're getting at trends that you saw in the overdose report, like which drugs were most frequently attributed cause of overdose death. And there were some basic questions that got at that addressed content from the videos, but they were pretty simple facts, such as HIV and hepatitis C as the more traditional public health outcomes of concern when we're working on the opioid, when it comes to opioid abuse and the risk factors related to injection drug use most specifically. So anyway, lots more information that you can find in these kinds of annual reports, at least from Ohio. Again, relatively less from the particular Kentucky report that I provided you, but there's more that you can pull from state dashboards these days, and I'll show you that later on in the term. Getting back to where we're at now and what you're preparing for and about to be tested on this coming Friday, starting Friday. We've got, again, it's like 4 videos and 2, 3, 4, 5, 5 required readings in week 3. Test 2 coming up will be really similar to the last one in the sense of multiple choice and maybe some short answer, but mostly multiple choice. You need to know where to find the answers within the assigned articles specifically. You'll be tested on pretty basic concepts, such as, what are the FDA-approved medications for opioid use disorder, essential differences between antagonist and agonist medications, receptors in the brain that these drugs work on, and particularly naloxone and how that effectively works in the body, mitigation and treatment strategies. Some of these were defined by Nora Volkow in this article. What else? The strategies that were basically defined by NIDA and then promoted in the Healing Community Study Continuum of Care approach. We won't get into fine detail, but you should understand broadly how the COWS scale is used. By reading the Herring article, you should gain an understanding of basic signs and symptoms of opioid withdrawal and steps in treatment of withdrawal using buprenorphine and other drugs. Things like the typical time course for opioid withdrawal and commonly used opioids are covered in this article. What else? By watching the videos and reading SHARF, this article here, you should have really gotten a pretty good understanding of the importance of OEND and reasons for novel strategies like EMS-based naloxone leave-behind programs. So, basically, what is naloxone? How does it work in the body? How has it been distributed and administered? And as described in these articles, kind of the typical contents of leave-behind kits or boxes and pouches. And basically, just what does it mean to be connected to a peer recovery support specialist? We might get into what are the significant findings reported by a SHARF study. How does accepting a kit as a friend or family member, how is that associated with client or patient outcomes? So these assigned videos with Dr. Herring and Euler are designed. They're really detailed explanations of medications for OUD and how hospitals start patients on buprenorphine and other drugs, and the basics, sort of pharmacology, research on barriers to naloxone furnishing, and perspectives on provided by the directors, EMS directors. So real basic facts will appear in test 2. Getting into week 4, we really learned more about insight in the other harm reduction interventions. Insight was covered in the NOVA video in week 1, and we really took a deeper dive using some of these articles and videos into the evidence for syringe service programs, and particularly the model that they have been implementing in Vancouver, Canada, in this video. These readings and videos address evidence behind supervised consumption sites or syringe service programs as they're combined in Canada, sensitivity of fentanyl test strips, drug check strategies, wounds related to xylazine, the features of and strategies that overlap with other drug use trends across the United States. So peer recovery and peer support specialists may have been supported by the Healing Community Study during the intervention timeframe that you've already read about. They could not initially distribute fentanyl test strips or for clients to supervise consumption sites within the funding provided to Ohio and Kentucky. We'll get more into that legal aspects of that later in the term, but for now, it's important to simply understand that test 2 may include simple facts from these videos and readings, mainly focused on fentanyl and xylazine test strips and syringe service programs or safe consumption sites as they're implemented in Canada, but not the United States. Some of these strategies are coming into the United States or getting pushed back in Canada, so that's a moving, evolving target for strategies that may or may not be reducing morbidity and mortality in states like Ohio and Kentucky. I just wanted to remind you all that the discussion boards are graded assignments, so make sure you reply to discussion board 4. It reflects on peer recovery practices and drug testing strategies. And reach out to me if you have any questions moving forward. I will be, after test 2 is over, I'll post a really simple rubric and explaining a video explaining the format and page length of your final paper. Yeah, that's not something that you need to focus in on until after test 2 is over. And so I hope this video has been helpful to review test 1 and give you a sense of how similar test 2 is going to be. I'll get your grades posted in Canvas this week or over the weekend for test 1, and then give you a summary of how you're doing at the midterm after I've graded test 2 next week. So have a great day or a great weekend, and again, reach out with a Microsoft Teams appointment invite if you want to meet sort of face-to-face and have a scheduled appointment.